Over the last several years, 48 hospitals in Ohio have been forced to close. More have been forced to merge or sell out to distant corporations. Those lucky enough to survive have seen local control disappear, and along with that loss of control comes the loss of jobs, healthcare services, and health education programs. Most of these closures or sellouts can be directly attributed to old, inefficient hospital buildings that prevent local hospitals from keeping pace with modern technology. Old hospital buildings create inefficiencies that lead to ultimate financial failure. Hello, I'm Christy Paul. I'm an anchor for CNN Headline News. I grew up in Bellevue, Ohio since I was 3, and I'd like to spend the next 7 minutes or so showing you how community leaders in my hometown are working to ensure that Bellevue and the surrounding area continue to enjoy convenient, high-quality health care. In 1917, the Bellevue Hospital opened with 24 beds and 9 bassinets. Its mission today is much as it was 86 years ago, when the founder of the hospital, Dr. J.C. Morrow, said at its opening,
"Its mission on earth is to care for the sick and injured. The doors of Bellevue Hospital will ever stand open to receive the poor patient and to extend the same courteous and scientific treatment that has extended his most fortunate brother."
Today, the Bellevue Hospital remains as one of only a handful of community-owned, community-led hospitals in Ohio. As a nonprofit hospital, 100% of its profits are reinvested back into new space, new technology, or other healthcare-related services.
Local control of the hospital is central to the Bellevue Hospital's ability to recognize and react to local needs. We have worked very hard to remain locally controlled and not be put in a position where we have to sell out to the large hospital chains.
During its first year of operation, the hospital treated 165 people. Last year, the Bellevue Hospital touched the lives of tens of thousands of people, including 2,413 people who spent at least one night in the hospital, over 14,000 people who utilized the emergency room, over 3,000 who received surgery services, not to mention the almost 400 children who were born there in 2002. In the last 15 years, the number of physicians practicing at the hospital has grown from 35 to 106. And it provided all of these services in a way that's very rare for community hospitals. It did it profitably.
Last year, the Bellevue Hospital billed out nearly $50 million for patient care. Of that, we maintained a profit of $900,000. As a nonprofit organization, we use that money to stay competitive with our salaries for our employees, purchase new equipment, and recruit new physicians to the area.
Yet each year, it becomes more and more difficult to provide quality care and remain financially secure.
The real challenge is our current building and site. It's too small to add on and operate efficiently. If we're not careful, we'll be like many small community hospitals, closed or sold to an outside corporation.
The challenge of operating a modern hospital from an old building is clear.
Here in radiology, we have very good state-of-the-art MRI open equipment, but our department is quite cramped, and as a result, the MRI unit is close to the street. Traffic can sometimes interfere with the scans. There are times when that necessitates either postponing the patient's scan for a period of time or repeating some of those images.
Here on Med-Surg, only 7 of our patient rooms have private showers. The other 28 patients have to share 2 showers.
Here in the pulmonary rehab department, we share space with diabetic education and cardiac rehab. Because of these space limitations, we're limited in the amount of time that we can schedule each group of patients. This is frustrating, time-consuming, and costly to everyone.
Parking is often a problem here in our cardiac rehab unit. In fact, we often joke with our patients saying that they have their warm-up period already done before they even get started.
While others in the hospital complain about their lack of space, at least they have space in the hospital. In occupational health, where we do physicals, pre-employment screenings, drug screens, and workers' comp injuries, we do all our work off-site because there is no room in the hospital for us.
Like other areas in the hospital, the radiology waiting room is nothing more than a cramped hallway leading to uncomfortableness for all our patients and their families, not to mention the lack of privacy.
When the weight of the x-rays started to buckle the floor, the x-rays had to move to cardiac rehab, and cardiac rehab had to move to health counseling services, and health counseling services had to move to Building B behind the hospital. Sometimes it's like musical chairs around here.
The board and senior team of the Bellevue Hospital considered remodeling and expanding. The problem with remodeling is that government regulations require that if one area is remodeled, the rest have to be brought up to current codes. As such, a renovation would mean the hospital would have to shut down for months and the entire building renovated to bring it up to current standards. And it would cost almost the same as building a new, larger hospital. The new Bellevue Hospital will be a 129,000 square foot, two-story facility located on 109 acres on U.S. Route 20 at the intersection of Township Road 302. It will have 50 all-private inpatient and 35 outpatient beds for pre-op and post-op patients. The new hospital will bring very real benefits to the community. The new intensive care unit will be close to the emergency room and include 4 observation rooms. The emergency room will have almost twice as many exam rooms, allowing for shorter waits, and radiology and surgery will be adjacent to the emergency room. There will also be a separate entrance for emergency patients and families. The new hospital will also include a birthing center where the entire birth process, labor, delivery, recovery, and postpartum can take place in the same room in a family setting. And the new nursery can be upgraded to a level 2 nursery. A separate outpatient surgery unit will be created with 21 beds, eliminating the confusion and inefficiency of using inpatient med-surg beds for outpatient procedures. Radiology will be expanded by about 50% and will now be large enough for the new filmless radiology equipment that allows images to be sent instantaneously via computer anywhere in the world. The new hospital also includes a comprehensive women's center to better meet the unique healthcare needs of women in our community. Parking, perhaps the biggest challenge at the old hospital, will be increased almost 50%. Even the dining room will be larger, allowing more people, mostly seniors, access to low-cost, high-quality food service. The new hospital will have multiple entrances, allowing convenient access for patients and families. And finally, separate waiting areas for different departments will offer better privacy. Additional shelf space will also be built, allowing the Bellevue Hospital to meet new, current unknown healthcare needs in the future without building new buildings. The new hospital will cost $36 million. The revenue to pay for it will come from several sources, including $19 million in low-interest nonprofit bonds that will be repaid by the hospital out of future earnings. This represents the maximum prudent amount that can be borrowed without jeopardizing the financial future of the hospital. A $7.5 million investment from Norwalk Area Health System, a $7.5 million investment from Firelands Regional Medical Center in Sandusky.
For our investment, we are given 20% equity in the new Bellevue Hospital, as well as 2 board seats. We're looking forward to the time, though, when Bellevue returns our investment and goes back to a totally Bellevue-based community hospital.
And finally, $2 million of the $36 million cost will need to be raised by the community. While the major issue of building a new hospital is one of long-term survival, the reality is that the community will see several key benefits to a new hospital. A quality, modern, and nearby hospital offering state-of-the-art health care will help attract new industry and new jobs. The Bellevue Hospital will not fall behind in the vital technology curves that drive so much of healthcare these days. A new hospital with new services will help draw physicians to the community, especially highly coveted medical specialists. The Bellevue Hospital could provide about 80% of the hospital needs of local residents if it had enough of the right type of medical space, leading to more convenience for the patient and better financial security for the hospital.
Bob, it's a great and exciting time for the Bellevue-Clyde community in the building of this brand new hospital. We have cooperation and assistance from 2 neighboring hospitals. We have the financing in place, and now we're looking to the community at large to help us and assist us in reaching our goal of $2 million for the Capital Fund campaign.
Certainly, Marv, any drive of this sort is of importance to our community. Our community takes part in things. They want to see things go, and this hospital is viable for the Bellevue-Clyde area.
Thank you for letting us share the story of Bellevue Hospital and why so many people are working so hard to ensure that the people of Bellevue continue to have convenient access to quality health care. Your support is truly appreciated.